And so we're back, and we're going to pick up the story here with psoriasis. Um, and so with psoriasis, this is a very difficult condition to treat and to manage. Sometimes dietary and supplementation things can help to improve it, and sometimes it doesn't have any effect. But I'm going to share with you what I have seen uh, as being helpful in some cases. So the idea would be to reduce the amount of arachidonic acid in the skin cells because it gives rise to prostaglandin series 2. Prostaglandin series 2 causes the cells to divide at a faster rate and makes skin cells that are drier and scalier and rougher as a rule. So the idea then would be to eliminate high fat and high animal fat products, meat and dairy, and get rid of the high linoleic acid containing vegetable oils, and switch to olive oil, canola oil, avocado, and so on. And alcohol and hydrogenated fats also tend to promote the inflammatory process even in skin cells. So you replace those foods by having proteins that don't have all the bad fats with them: chicken breast, turkey breast, fish, Cornish hen, lower fat dairy products, more plant-based protein-containing foods, lower fat dairy products, of course, olive oil, canola oil, peanut oil, just getting rid of the linoleic acid. In terms of supplementation, you can try to attempt to decrease sort of the immune inflammatory reactions that are going on. So this is where herbal detoxifiers and immune support can be helpful. There's some evidence that milk thistle can be helpful in psoriasis by improving detoxification of impurities that are in the bloodstream, so the immune system is not reacting quite the same way, and toning down the immune inflammatory reactions that can be part of psoriasis. The indole 3-carbinol, of course, helps with detoxification. Medicinal mushrooms act as biological response mediators for the immune system. So does astragalus. You can try these kinds of combinations, helping to digest food more effectively, so that partially undigested food doesn't leak through the gut wall and produce immune inflammatory responses. So digestive enzymes, prebiotics, probiotics, all these things can help to improve the gut function and to stop sort of antigens from leaking into the bloodstream, or partially digested food that's small enough to cross into the bloodstream doesn't get there and produce an immune inflammatory response that would affect the skin. And oil of oregano, the studies at Georgetown University show that the wild oregano P73 blend actually kills Streptococcus bacteria experimentally. And some cases of psoriasis are set off after a person has a strep throat. And then as the strep throat is clearing, a week or two later, they have their first outbreak of psoriasis. That's not uncommon. So doctors have discovered by using antibiotics, they can sometimes control psoriasis. Often in the plaque of the patient with psoriasis, there is Streptococcus bacteria. So somehow the Streptococcus bacteria sometimes falls into the psoriasis model. So oil of oregano, because it can kill the Streptococcus bacteria to some degree, and you can use it on an ongoing basis, unlike antibiotics, it can be tried to see if it'll sort of reduce some of the lesions. So you would take it internally as the capsules and then put the topical cream on the actual psoriasis plaque to see if it helps. It's not always going to help, but it will in some cases. And secondary support, high potency multivitamin to help make healthier skin cells, essential fatty acids to make better skin prostaglandins. You can use sort of a combination of these things and see if it helps the patient. There's a thymus extract that's been shown to be helpful in psoriasis. You can read about it at this website. It's called Thyme Uvocal, but it usually has to be administered via injection, as you see. So for a lot of practitioners, they don't have that in their controlled acts. They can't do it. But for those kinds of doctors who can inject these kinds of substances, this has been shown to be helpful in some cases of psoriasis. And then with eczema, well, you have a better chance of helping patients with eczema. So there are three main objectives in the treatment of eczema. They include reduce inflammation, relieve itching of the skin, and moisturize the dry patches. And attention to diet and supplementation can help accomplish all three of these objectives. So in terms of diet and lifestyle considerations in eczema, the first thing is the patient sensitive to a particular food, allergen, or environmental irritant? It could be the type of detergent they're using, or a cleaning agent, or a soap, or a new shampoo that they switch to that's producing this atopic reaction. Or it could be that they have a food sensitivity. So an elimination diet or doing IgG testing or food allergy testing can help to identify things that the person's sensitive to. Beyond that, you want to reduce the inflammatory behavior of the skin. So again, you use the same dietary strategies that we talked about for psoriasis, reducing arachidonic acid and high linoleic acid containing oils and alcohol and hydrogenated fats, replacing that with lower fat protein foods and both dairy and flesh protein foods, and more plant-based foods, and using the monounsaturated oils and avocado and so on. Then with supplement considerations, essential fatty acids sometimes can make a huge difference in eczema. There's evidence to show that gamma-linolenic acid metabolism sometimes is at fault here in essential fatty acids in eczema production for some people. And to convert gamma-linolenic acid into prostaglandin series 1, of course, you need B vitamins and magnesium and zinc and more antioxidants. So a high-potency multivitamin pushes that pathway along. And there's some evidence that the topical application of hyaluronic acid serum can help in certain cases of eczema. So here's a story around gamma-linolenic acid. So studies indicate that many cases of eczema are caused by a genetic defect whereby individuals with eczema are missing an enzyme that synthesizes an essential fatty acid known as gamma-linolenic acid, GLA. It's required for normal skin cell development. Supplementation with a combination of borax seed, flax oil, and fish oil can correct this deficiency by providing the body with gamma-linolenic acid and other essential fatty acids, enabling skin cells to form normally and reducing skin inflammation and reversing eczema. Or you can just give the person a high GLA oil, like evening primrose oil or borax seed oil or black currant oil. They're very high in GLA. Skin cells require sufficient concentrations of specific vitamins and minerals as cofactors to convert essential fatty acids like GLA into these prostaglandin hormones within the skin that reverse and reduce eczema lesions and improve skin softness and smoothness. For this reason, consider an essential fatty acid supplement that for sure has borax seed oil. I also like flaxseed and fish oil, as you know, in conjunction with a high-potency multivitamin. Hyaluronic acid is a chemical that's normally synthesized by skin cells and plays an important role in maintaining skin integrity and hydration. Studies reveal that the topical application of concentrated hyaluronic acid serum can speed the healing of eczema lesions in many cases and should be used in conjunction with supplementation of essential fatty acids and a high-potency multi in a sort of a trial basis for eczema cases. Secondary support is to decrease those immune inflammatory reactions in the body, to which you would use, again, things like milk thistle, the indole 3-carbinol, medicinal mushrooms, astragalus, to sort of tone that down, digestive enzymes and prebiotics, helping to stop things from entering the bloodstream that can produce immune inflammatory responses that sometimes get manifested in the skin. So the same way that, let's say you're allergic to strawberries and you eat a strawberry and you break out in hives. So the skin can respond to these abnormal immune responses that go on. So these low-grade immune inflammatory reactions can occur if you don't completely digest food properly, and small tripeptides and dipeptides leak into the bloodstream. The body views that as an antigen, so the immune cells make antibodies against it. You get these immune inflammatory responses, and skin can be affected by that. So if you can detoxify things more effectively in the liver to get any kinds of irritants detoxified, and you can regulate the immune system better and have a better digestive system, then you might help to tone down these immune inflammatory responses and clear endotoxins from bacteria out of the system more effectively as well. We think that's how milk thistle is helping in psoriasis in some cases, that some unfriendly bacteria in the large bowel produce endotoxins that leak into the bloodstream, and they produce immune inflammatory responses, and the skin gets worse. Milk thistle helps to improve detoxification of the liver and clear those things, so the blood is purified, if you will, and you have less immune reaction, and so the skin manifests the improvement in that overall immune inflammatory response, which is now toned down. Then with rosacea, well, rosacea is aggravated by the consumption of hot drinks, alcohol, and spicy food. So hang on to that for exam question purposes. Other irritants like too much sun, extreme temperatures, either air or water, excessive physical activity, and stress can all trigger rosacea. And stress is a big one. It can be aggravated in women by an imbalance of estrogen and progesterone as well. That's not an uncommon aggravating factor in rosacea. There are some supplements that have been shown to help. The wild oregano P73 blend has been shown to kill the skin mite and bacteria that are sometimes associated with the rosacea. So you would take the capsules internally, put the cream on overnight on the face to kill the skin mite and or bacteria that's been linked to rosacea. And I've seen very good improvement using that strategy. You may want to also add herbal detoxifiers to sort of purify the blood and tone down the immune system with these biological response modulators. And for people that have frequent exposure to ultraviolet light, this sort of goes to the studies that I was talking about, where there's evidence to show that giving individuals supplements with antioxidants and B vitamins has been helpful in decreasing free radical damage in the skin and photoaging and biomarkers that are linked to cancer. So we'll look at, the story unfolds here. Here we go. High potency multivitamin. Studies reveal that antioxidant supplementation of vitamins C, E, beta carotene, selenium, and zinc are essential in the fight against free radical damage to skin cells. High doses of niacin have also been shown to help the skin repair damage caused by ultraviolet light in experimental studies by upregulating DNA repair enzymes. And so there you see the evidence for that in the journal Nutrition and Cancer. As such, a high-potency multivitamin mineral is an important supplement consideration in cases where people are exposed to ultraviolet light. That's most of us. And then studies showing additional vitamin C can be helpful at 1,000 milligrams or 2,000 milligrams a day. According to the research by this researcher noted above, individuals who were administered 2,000 milligrams of vitamin C per day from a supplement showed a remarkable ability to reduce skin damage from UV light compared to individuals who were not given the antioxidant supplement. This may be a level of intake one should consider on days where exposure to UV light is likely to be more excessive. So this study, 2,000 milligrams a day, has been shown to be significant in toning down the amount of free radical damage to skin cells sort of imposed by UV light. And same with vitamin E at 600 IUs a day or 1,000 IUs a day in total. According to the same researcher, individuals who were administered 1,000 IUs of vitamin E per day from a supplement showed a remarkable ability to reduce skin damage from UV light compared to individuals not given the antioxidant supplement. So you're saying, who is this guy? B. Eberling, Koenig et al. So that comes from, see this research here? Published in this dermatology journal in 1998. And then some follow-up studies as well, antioxidants protecting the skin. So they all point in the same direction, that vitamin C and E and beta carotene and selenium and zinc and niacin can help to reduce damage that's inflicted on the skin by ultraviolet light, helping to decrease biomarkers that would be suggested that the skin is moving towards photoaging, but also even mutations that are linked to skin cancer. So I'm just saying this as my own opinion, that supplementation with antioxidants and these other nutrients are should be part of the way in which we protect our skin over our lifetime, over and above all the strategies that are out there, wearing protective clothing, reducing UV light exposure, and high SPF sunscreen. The fourth peg of that system should be the consideration of these supplements at these dosages for people that have UV light exposure on a regular basis. Now with nail fungus, normally the person would get a medication for this, but remember that the antifungal medications are very harsh on the liver. So one thing that can be tried initially is to take oil of oregano, where you actually have the oil in a vial, and you put the oil right on the nail fungus. I've seen this clear up some nail fungus conditions. And also take the oil of oregano capsules, the P73 Wild Blend, internally as well to help kill the fungus from the inside out. I've seen that work very well. You may want to add these herbal detoxifiers and immune support for immune modulation. I'm not sure that's critical in this instance. Then for people that have dark circles under their eyes, or they have irregular facial pigmentation or sort of a dull complexion, these dark circles can just be genetic. For some people, they just genetically convert more of the amino acid tyrosine into melanin pigment, and it happens under their eyes. So there are dermatologists actually have these creams that inhibit tyrosinase, which is one of the enzymes that converts tyrosine into melanin. That has it's a whitening or a lightening cream that helps to block that melanin production, and so it can sort of lighten the skin in that area. So that's not really a nutritional intervention, that's for in genetic cases. But sometimes people just have a lot of impurities in their bloodstream because their diet's so bad. If you just clean up their diet, give them some herbal detoxifiers, support the immune system, give them digestive enzymes and prebiotics and probiotics, often their complexion looks a heck of a lot better, especially if you add high-potency multivitamin and essential fatty acids. People's skin often looks better when you get the bad fats out of the diet, get them to a more lower glycemic diet without so much sugar and insulin kicking around, and then you add prebiotics and digestive enzymes and multivitamin essential oils, and you upregulate detoxification with milk thistle indole 3-carbinol. You modulate immune system function with reishi mushroom extract, astragalus. Those types of combinations, the person's complexion within 3 months sometimes can be dramatically improved. And then with warts, well, there's standard treatment for warts where you see a dermatologist and they'll just basically they have chemicals that will just kill the virus. But if you want to, as a first effort, apply some oil of oregano oil right onto the wart itself. Sometimes that will actually kill the virus and knock it out. Can't guarantee it's going to work every time. This will take us into systemic and metabolic health conditions. So as we continue down, we looked at all these skin conditions, and then we looked at cardiovascular conditions, if you recall. And we looked at gastrointestinal conditions, and now we get to systemic and metabolic health conditions on the intake questionnaire, right? This is all happening on the first visit. You're sort of trying to understand the person's chief complaint and any comorbidity issues where nutritional medicine could play a role in helping to improve outcomes. So as they look at the intake questionnaire to ask them, do they have non-insulin dependent diabetes? Do they have diabetes? Do they have an underactive thyroid? Do they have osteoporosis or osteopenia? Do they have osteoarthritis? Do they have any rheumatoid arthritis or an autoimmune condition that affects their joints? Do they have multiple sclerosis? Do they have Parkinson's disease? We've covered the nutritional medicine management of all of these. So there's no need for me to repeat that here. Just bring it to your attention that if they say yes to any of these, then you say, oh, hey, I might have a partial solution for you for some of this, something we can add to the medical management. Same is true for gout or hepatitis C, for hay fever, where we've seen recently giving people probiotics twice a day, and also the use of quercetin toning down the histamine response has been very helpful for people. We're going to talk about chronic bronchitis in a moment. We've talked about canker sores. We've talked about cataracts, macular degeneration. We'll talk about chronic fatigue. We'll revisit fibromyalgia. We'll look at varicose veins. We've talked about constipation. We'll look at scleroderma and sarcoidosis. For tendonitis and bursitis and muscle inflammation, we know about the natural anti-inflammatory herbs that can be helpful. We'll look at Raynaud's disease. We'll look at restless leg syndrome. We'll look at tardive dyskinesia. Candida, we'll look at that. HIV infection is really beyond the scope of what we're going to talk about in this program. So let's get into chronic bronchitis. Again, that oil of oregano, that P73 wild oregano blend is really spectacular. I've seen it take cases of sort of chronic bronchitis problems after the person's gone through their bouts of their antibiotic regimen, and there's still sort of a lingering gurgling in the chest, and the person's still coughing up sputum from time to time, and they've got a bit of a chronic cough. They can go back on antibiotics for a second round, and even then sometimes it doesn't totally clear. And the doctor's not going to keep prescribing antibiotics over and over again, but the person's left with sort of some chronic sort of bronchial congestion, if you will. And I have seen that the P73 wild oregano blend, taken as capsules, have knocked that right out and cleared the bronchial tree by killing off the rest of the pathogens. Again, you need to take a probiotic with it. You also want to give the person constitutional support with a high-potency multivitamin to strengthen the immune system. You might want to add essential fatty acids. These are secondary considerations. It's the oil of oregano that's the big winner here. And then Coleus foresculi, we saw this in terms of the weight loss component when we talked about sports nutrition, but Coleus is extensively researched in India over the last 20 years. There have been studies to support its anti-asthmatic and antispasmodic effects. So a typical dose is 250 milligrams 2 times a day. So that can also be helpful in bronchial asthma. And then grapeseed extract with these unique flavonoids known as proanthocyanidins have this effect on histamines and prostaglandins, which can be used for allergies and asthma as well, to help sort of slow down the histamine release from the mast cells. So again, more in bronchial asthma, these things would be called upon. For sort of chronic bronchitis, the oil of oregano really is the key thing. Even in asthma, I've seen it where you give the oil of oregano, because in those secretions in the person with asthma, sometimes you start getting pathogens that are sort of multiplying in there. And when you knock them out, often the asthma actually improves. So this will take us to chronic fatigue syndrome, Epstein-Barr, chronic mononucleosis. What do you do in these cases? You try to strengthen the immune system, you try to knock out any lingering pathogens that oil of oregano can attack, and you try to increase energy production. So the high-potency multivitamin with 1,000 milligrams of C and extra E and beta-carotene and selenium and zinc, all these things are strengthening the immune system and giving that kind of constitutional support. And then oil of oregano helping to knock out some of the pathogens that might be lingering. And it gives you knock those pathogens out, the person has energy right away. And then CoQ10 and hawthorn, increasing energy production at a cellular level. And then creatine monohydrate doing the same thing, increasing energy production, in important tissues of the body, muscles, give the muscle strength back. And then, supporting the immune system with astragalus, reishi mushroom extract, helping to clear toxins from the body with milk thistle and indole 3-carbinol. Combining these things together often helps to get this person out of that chronic fatigue, chronic mono state. Then there are studies using NADH, nicotinamide adenine dinucleotide, which of course is required for energy production in the mitochondria. So there's a couple of studies that are interesting using not just niacin, but this NADH form of niacin. And there are these new NADH type supplements coming into the marketplace with some really interesting research. It's still very new, but I think you should keep your eye on it because there might be some new forms of niacin that work better than just giving standard, niacin that we did traditionally for so many years as vitamin B3. Some of these more fully developed NAD type products may have some advantage if given at a high enough dose. So keep an eye on that research. And then vitamin B12 injections have been shown to be helpful in some clinical trials with people that have chronic fatigue syndrome. And again, sublingual B12 at high doses like 2,500 micrograms or 5,000 micrograms taken sublingually can sometimes substitute for the injections. And then with fibromyalgia, just to revisit it, things to consider: a high-potency multivitamin, essential oils, but then anti-inflammatory herbs to tone down the inflammatory reaction. Things like curcumin, boswellia, white willow bark extract, ginger, toning down prostaglandin series 2. And then studies showed that 5-hydroxytryptophan can be helpful. So people with fibromyalgia often have low serotonin levels in their blood. Supplementation with 5-HTP can increase serotonin synthesis by providing the brain with more of the raw material, right, as we know. Both preliminary and double-blind trials have reported that 5-HTP at 100 milligrams 3 times a day over a 30-day course of treatment relieves some symptoms of fibromyalgia. It says here you can't be using it concurrently with antidepressant medications, but the truth is that you can just monitor the person for serotonin syndrome, which is unlikely to happen. And you might want to just bring the dosage down to something lower, maybe 50 milligrams 2 or 3 times a day if they're already on an antidepressant. If they're not on an antidepressant, you can give them the full dose, 100 milligrams 3 times a day. If they're already on an antidepressant, I would cut that dosage back personally to maybe 50 milligrams 2 or 3 times a day. And then S-adenosylmethionine has been shown to be helpful as well. A 6-week double-blind trial with 44 patients receiving 800 milligrams a day of SAMe reported improvement in clinical disease activity, pain, fatigue, morning stiffness, and mood in the activity-treated group compared to placebo. So the group that was given the supplement outperformed the placebo. In an earlier double-blind crossover trial with 17 patients, SAMe reportedly reduced levels of depression and it saw a decrease in the amount of pain and number of trigger points. So that's a key thing in fibromyalgia, decreasing the trigger points and the amount of pain. So it might just be an energy production problem within the muscle tissue itself. Possibly these people have a methylene tetrahydrofolate reductase enzyme polymorphism problem. You should be really checking their red blood cell folate, the serum B12, and homocysteine levels to see if there's a pattern there that would suggest that they need to be taking methylfolate. That the problem really is that they're not able to make that form of folic acid to make enough SAMe, and in a SAMe deficiency, you don't get certain end products made that are required to have healthy muscle tissue, so you end up with more inflammation. And then melatonin has also been shown. In one study reported the patients with fibromyalgia syndrome had nighttime melatonin levels that were 31% lower than placebo controls. This may contribute to impaired sleep at night, fatigue during the day, and altered pain perception. In a therapeutic trial, 3 milligrams of melatonin given daily at bedtime resulted in significant improvement in sleep, number of trigger points, and severity of pain at selected points. And it says melatonin cannot be used concurrently with antidepressant medications, but in truth, I wouldn't hesitate to combine them, to be honest. I think melatonin is a fairly safe, benign thing to add even to antidepressant medication. You're not going to potentiate the effects of melatonin, of those drugs on serotonin synthesis, because melatonin's already further downstream in the metabolic cascade. Other things to consider in fibromyalgia. Remember that a lot of fibromyalgia patients often have irritable bowel syndrome, so giving them digestive enzymes and prebiotics and also probiotics can sometimes be helpful. And a study using magnesium hydroxide and malic acid. There's some preliminary reports that indicate that pain levels are reduced and that the symptoms of fatigue may improve with 2 weeks of supplementation with magnesium and malic acid. The combination of the two is thought to increase energy production and reduce lactic acid, a source of muscular tenderness and pain. So that's a full protocol there for fibromyalgia. High-potency multi, essential oils to reduce inflammatory prostaglandins, anti-inflammatory herbs, 5-HTP to raise serotonin levels, SAMe to help the body make these methylated substances that seem to be important in reducing point tenderness and pain, melatonin to get a better night's sleep and reduce pain through the day, and digestive enzymes and prebiotics, especially if there's concurrent irritable bowel syndrome, which there often is in fibromyalgia, and then this magnesium malic acid combination. These things all have merit, and if you combine them all, you've got a good fighting chance you're going to help this patient in conjunction with whatever other hands-on work and body-mind work that you might be doing with the patient. And then there's varicose veins. There is an herb called horse chestnut, And you can read about it here. The active constituents seem to help support the collagen structures that seal blood vessels to stop them from leaking and forming microcapillary sort of damage that can produce varicose veins. Patients that I know who have tried horse chestnut have not seen great results, so I don't know how much faith I have in this. Again, a high-potency multivitamin with vitamin C and bioflavonoids and copper may help to strengthen that connective tissue around the veins. But by the time the varicose veins are there, it might already be too late to reverse any of this. You might be able to slow the progression of any further varicosities, and so that would be probably more the application for this information that you're seeing here. Grapeseed extract, its proanthocyanidins also support collagen and the basement membrane of blood vessels, may be helpful. And then Gotu kola, which is an herb that also helps to support the glycosaminoglycans, cement substance between cells, may also help with chronic venous insufficiency and venous leakage in this manner. So where you have the tendency for venous leakage and these microcapillary sort of breakdown, you think vitamin C, bioflavonoids, grapeseed extract, Gotu kola, and horse chestnut is sort of your considerations if the patient's looking for something that may help. So I think we'll leave it there. We'll come back and we'll pick it up with scleroderma. I'll see you after the break.